Hello, my name is Amber Ricks and I work with Ross & Yerger Insurance. We're the broker for your employer and assist with your employee benefits. Today I'm going to discuss the benefits that are available to you as an employee. The month of October is your open enrollment period. We call this your freebie period because during this time you can make any changes you need to your current benefit elections without having a qualifying event. This may include adding or dropping dependents or adding or dropping the coverage. Any changes made during this time will be effective November the 1st. You should have received a booklet and may or may not have it with you while watching this video. While this video will give an overview of all the benefits available to you, the printed booklet will contain a bit of additional information for you. If you are a full-time employee and have satisfied your 30-day waiting period, you are eligible to enroll in coverage. As previously stated, any changes you make during the month of October will be effective November the 1st. If you wish to make a change during this time, you will need to contact Colin Dexter to retrieve the necessary forms. Completed forms are due back to Colin by Thursday, October the 29th. Once you have made your elections, you will not be able to change them until the next open enrollment, unless you have a qualified event such as marriage, divorce, birth of a child, adoption of a child, loss of other coverage, etc. If you experience an event during the year and need to make a change, please contact Colin. We have some exciting news to share with you. Your health administrator is changing to UMR effective November the 1st. You can see the flyer on the screen and should have received the notice along with your booklet. This change is being made in order to improve service and to help maintain the current cost of this benefit. Without the change, costs would have increased. Because of the change, costs are decreasing. There will not be anything for you to do during this change. It will all happen seamlessly, plus your benefits are staying the same, and there are newly added benefits when using Yalobusha providers. I'm going to provide a brief overview of your two medical plan options. The first option is the standard plan. As you can see, your benefits are still the same. Your individual deductible is $1,500 when using an in-network provider. The network is the UHC Choice Plus network. The deductible comes into play when you have surgery, if you visit the emergency room, or if you have to have any type of diagnostic scan such as an MRI. You will notice the deductible when using a Yalobusha provider is zero. Once your deductible is met, you will share the cost with the insurance carrier until you meet your maximum out-of-pocket of $4,000 for an individual. When using a Yalobusha provider, you will split the cost 80-20, and when using an in-network provider other than Yalobusha, you will split the cost 70-30. When using an out-of-network provider, you will split the cost 50-50. However, please note there is no maximum out-of-pocket limit when using an out-of-network provider. It is very important to use a Yalobusha or an in-network provider for services. Additional benefits of using a Yalobusha provider are lower copays for office visits at $25 instead of $50, as well as lower copays for prescription drugs. During the year, your deductible and all coinsurance and copays go towards your out-of-pocket maximum. Yalobusha General pays the entire cost of an employee's coverage on this plan. Dependents are additional, and the biweekly premiums can be seen in your booklet and on the screen. Now I will review the benefits for the enhanced plan. This plan has a lower deductible at $500 for an individual. The coinsurance is also shared differently, with less owed by you as the member and more paid by the carrier. The out-of-pocket maximum is $500 less as well at $3,500. The copays for the in-network providers are the same for physician visits and prescriptions, but are lower when using a Yalobusha provider. You can buy up to this plan for only $12.61 every 2 weeks for employee-only coverage. You can see the dependent rates on the screen and in your booklet. Your prescription benefits will be handled by ProAct. There is a flyer on the screen and in your booklet that details information related to mail order, prior authorization, and online resources. Contact information is also listed. If you have any prescriptions that are filled at a retail pharmacy, please be sure to present your new identification card to inform your pharmacy of the change. If you experience any issues filing a prescription that requires prior authorization, do not leave the pharmacy. Contact ProAct immediately for a resolution. Your dental coverage will continue to be with Guardian. Your benefits and rates are on the screen and are the same for this plan year. You have a $50 deductible that only applies to basic and major services. Preventative services such as cleanings and bite wing x-rays are covered at 100% and the deductible is waived. Once you pay your deductible for a basic or major service, the plan will split the cost with you. They pay 80% and you pay 20% for basic services, and major services are split 50-50. The plan will pay $1,000 per member per year for benefits. The plan also has an ortho coverage for all members and dependents. It will split the cost with you 50-50 and pay out a lifetime maximum of $1,000 for each member. You can see a list of sample services covered by your plan as well as the rates on the screen and in your booklet. Your vision coverage will also continue to be with Guardian. There will be no changes in rates or benefits for this coverage. You can see the details of the benefits on the summary. It is important to use an in-network provider as you get the most from your plan when doing so. There is no copay for an exam or the lenses listed on the summary. You have a $150 allowance towards frames. After the allowance, you will split the cost 80-20 with the plan. You pay 20%. You have the same allowance for contact lenses, and any amount over the $150 will be split 85-15. The plan will not pay for glasses lenses and contact lenses in the same year, so if you wear both, you will need to alternate the benefit. All benefits are payable yearly except for frames. Those are covered every 2 years. Yalobusha General pays for you to have a life insurance policy. The amount is 1 times your annual salary. It does include an accident and dismemberment rider, which means the coverage will double in the event your death is due to an accident. There are age reductions in place as well that begin at age 65. Please remember to update beneficiary information with call-in as needed. These forms are kept in your file, and in the event of your death, the form will be pulled and whoever is listed will be entitled to receive the funds, even if they are an ex-spouse. A beneficiary change can be completed at any time. This is just a good time for a reminder. You have the option to supplement your employer-paid life by purchasing voluntary life. If you are currently enrolled in the coverage and have less than the $50,000 guaranteed issue amount, you can increase your coverage up to that amount without having to complete an evidence of insurability form, or EOI for short, during open enrollment. An EOI is a form that asks a few health questions and is sent for underwriting and has to be approved. This can be completed online or on paper. If you do not currently have the coverage, you are able to enroll at this time. However, you will have to complete an EOI and go through underwriting. The minimum amount you can elect for yourself is $10,000 and $5,000 for your spouse. The maximum coverage you can elect for yourself is $400,000 and $20,000 for your spouse. The AD&D is included in the premium. This benefit allows your face amount to be doubled in the event your death is due to an accident. In order for your spouse or your children to have coverage, you must have coverage as well. The rates can be seen in your booklet and are based on age and amount. You'll find your age bracket and move across to the amount of coverage you're interested in, and that box will indicate your biweekly premium. The child rates are listed at the bottom of the rate page in your booklet. They are 46 cents for $5,000 and 92 cents for $10,000 of coverage. You pay one premium for all children. Please note that if a child is over 19, they have to provide student status. The final 2 benefit options you have available are accident and cancer policies. These are supplemental options. This means they pay an additional benefit to other coverage such as medical insurance. These benefits are paid directly to you and can be converted to an individual plan if you leave Yalobusha General. Each coverage plan has 2 options. The complete details for the plans are in your booklet. This last page is in your booklet near the end, but I wanted to be sure you were aware it was available to you. This includes contact information for all of your providers as well as myself and Colin. You can use the websites listed to search for in-network providers to make sure you get the greatest coverage when using your benefits. Please note that the information contained in this overview gives a general description of the Yalobusha General Hospital program. It does not give you all the details. If you need more information, please refer to your summary plan description booklets. Thank you for viewing this open enrollment video. Have a great day.